I can't see you though, so is that good?
Can you see me now?
Yeah, I can see you.
Greetings. So we started a little late. I'm sorry, but I just want you to tell about yourself. Introduce yourself and tell the people who you are and what you do.
Okay, my name is Dr. Renee Yearwood. I am an optometrist in the Bronx, and I am actually born and raised in the Bronx, in the South Bronx. And basically, I attended public schools, went to, for undergrad, I actually went to Fashion Institute of Technology. So my bachelor's degree is actually in marketing. And I also went to Queens College for a year and a half, and then went to optometry school in Manhattan, SUNY College of Optometry. And I am currently the director of optometric services at Union Community Health Center. I actually worked also at St. Barnabas Hospital for about 20 years in the optometry department. And prior to that, I was on staff at the College of Optometry as an assistant clinical professor.
Oh, well, I didn't even know your resume was that deep. So where you work now, where is it located? What's the name of it and the place again?
It's called Union Community Health Center. It's in the Bronx on Valentine Avenue and 188th Street, in right near Fordham Road.
So altogether, you have about how much experience with dealing with eyes and being an optician?
I guess. Century? What'd you say?
I said about a quarter of a century.
Yeah,
that's a lot of experience.
Yes, about that. Yes, and I've primarily done clinical optometry, meaning not really like in an eyeglass or optical setting. It's my training has primarily been in hospitals. I've worked at Lincoln Hospital. When I was with the College of Optometry, I established clinics for them in near like 149th Street in the Bronx, in Washington Heights. I established clinics. I did my residency in East New York, and I've done like basically hospital-based care or in like ambulatory care centers.
Oh, and you got it down packed, and I'm glad you said it with such ease and finesse because your credentials are impeccable. Nobody can say you have the credential. You don't have the credentials.
Exactly. Yep, that's the one thing people can't take from you is education.
That's for sure. But the first question that I wanted to ask, as far as the eyes is concerned, now I always was told and heard that carrots are good for your eyes. Is that true? And if so, or if not, what foods are good for your eyes, if any?
Okay, so the carrot thing goes way back, and the reason is because the carrots have vitamin A. Now the thing is, over all these years, I've had one patient say to me that she felt that her vision was getting bad, and so she started eating a lot of carrots. Like she was eating like a lot of carrots, drinking carrot juice and everything, and she feels that it made her vision better. Now the thing is, let's say for instance, like if you're lacking in a certain vitamin, right? And you start eating something with that particular vitamin and you say, my God, it fixed, my problem. So it's not going to, for the most part, not necessarily going to cure your vision. But let's say, for instance, if you are lacking in like vitamin A and you find your vision has been like a little bit decreased at night, then you say like, wow, my vision got better, because that's the thing that they actually realize, that the vitamin A is needed as far as like helping like with your night vision and things like that. So it doesn't work like that. It doesn't, you need other things. You need minerals like lutein. There's another one called zeaxanthin, which helps the inside of the eye, which is called the retina. And the key thing is to basically have a diet that is colorful, meaning you want blueberries, you want spinach, you want yellow peppers, you want fish, you know, red meat, even, you know, things like that. So you want your diet to be varied. And that's the thing. Like, so eating one particular thing is not going to get it, even for your body. You know, you can't just eat one particular food and be like, okay, I'm okay. You have to eat a varied diet. And because there's different things that come from different things. So like blueberries and all different kinds of berries, blueberries, blackberries have a lot of antioxidants, which is good for any of your cells. You don't want them to oxidize, because you think about metal, when it oxidizes, it gets rust. Mm-hmm. So you want like things which prevent oxidation of the cells. So that's where the blueberries and the strawberries and blackberries come in. But you also want other things like zinc, you know, like for instance, peanuts. You can get zinc from peanuts. You can get also pumpkin seeds are good. Things of that nature. Fish as well. Fish helps.
Now, does it matter how you cook the fish, or just fish? Period?
Well, you don't want to eat. I mean, any kind. You really don't. You want to stay away from like a lot of fried foods, and that's not necessarily just because of your eyes. That's because of your body. Period, and your blood vessels. And anything that has a blood supply. So the frying the food is basically not good for us at this point, unless you air fry it, you know, which actually I've been doing quite a bit, and it actually comes out like very good, the food, when you air fry it. So you want to decrease the amount of oil that you're using in the food. And there's certain oils that are better and certain oils that are worse for your body in general. So you don't want a lot of corn oil, but you may want more so like a grapeseed oil is better for your body. But as far as cooking and preparing, whether it's fish, whether it's your vegetables, you don't want to fry it. You know, you don't want to fry or deep fry things. You don't want to eat too much of that stuff. And that's just basically for your body, because anything in your body that has a blood supply, you know, not just your eyes, gets affected by any extra like of the oils basically kind of building up in the arteries and the veins.
So let me ask you this. You mentioned minerals a little while ago. You mentioned two specific minerals when I asked about the carrot.
Yeah, it's like lutein and zeaxanthin.
Now, where can you? What foods do they have those in?
I'm trying to figure out like, okay, because I know like basically I believe from fish and what else? The lutein.
Do they sell the vitamins? Do you know if they sell those type of vitamins?
Well, yes, you can actually buy eye vitamins, which have like those particular things in them.
Oh, I didn't know that.
Yes, you can buy eye vitamins with those particular things in them. But they're typically, those vitamins are typically kind of marketed to older people who, like, you know, in their 60s, or who may or may not have issues with the inside of the eye called the macula, which is what the area that we use when we're looking directly at something. That's where your best vision is. So when you're looking directly at something or someone, that's the area that you're using. And that area is very sensitive to like the UV from the sun, ultraviolet light, those minerals that I mentioned, the lutein and the zeaxanthin, those actually help that area. But someone who's 30 years old really doesn't need to take those particular supplements. You should be eating your food, you know. And like I said, it's more so like
where could they get the
find out if it's a specific fish?
Probably salmon, because salmon has a lot of fish oil in it. But you know, there's probably more than one. Now, for somebody who might be watching and listening and who is a little older and might think they need them, where could they get these eye vitamins from? Are they pills?
Well, like for instance, I'm most pharmacies carry them. Okay, so like for instance, a lot of people know of Centrum, right? Centrum vitamins, once you hit like 50 or whatever, Centrum Silver and Centrum different ones. But there's a couple of different brands. There's like Ocuvite and things like that, but they're available in like Duane Reade and Rite Aid and smaller pharmacies as well. And it'll basically tell you that they have that in it. It'll have it may also have like zinc. They may have like vitamin A in them, like other different things as well. So
you, can you take it to maintain your eye vision, or it doesn't really improve it? Only when something is
well,
wrong.
the thing is you already you have it there already. So when you're younger, the best thing to do is actually something as simple as wearing sunglasses, because the sunglasses are actually going to block the ultraviolet that's coming in your eyes from the sun, because that's what winds up breaking down like that area in the eye. So
sun.
Yes, sun is great. We need the sun, but the ultraviolet from the sun is not good for your eyes. So it affects that particular area of the eyes, and that's where you get that damage at.
Oh, see, 6, 7 minutes into the interview, and I learned a lot already. That's why I wanted you to come on, and we thank you, because believe me, somebody's going to learn something from this. So what happens to the eyes? Like, say for instance, with diabetes, what does the disease do to the eyes to make you lose your vision? If you could answer that, and also with age afterwards.
Okay. So one of the things that most people, when they think about diabetes, you hear about people having lost, their toes, and they got to get their, amputations and things like that. And the reason that it starts there, or they'll say they have problems where they have no sensation in their fingers and things like that, because diabetes affects the small blood vessels in the body first. So that's why their diabetics are told you got to get your feet checked, because that's one of the first places which gets affected, because the circulation starts getting affected. So diabetes basically winds up affecting those tiny blood vessels. It makes them more fragile. And because they become more fragile and they become like thinner. So a lot of times what happens is the body just knows it needs oxygen. So as far as the eye is concerned, the reason they tell people who are diabetic that they need to get their eyes checked at least once a year is because the eye is the only place in the body where we can actually look and visualize the blood vessels and see what is actually happening to that blood vessel. So if something's going on in your fingers or your toes, you can, tell the doctor, okay, it feels this way. They can look on the outside of the fingers or the toes and look at the color of it, but they can't actually visualize the blood vessel. So the eye, we actually look in and we see the actual blood vessels. So if there is bleeding and leakage, we can actually see that. So that's why they're told you have to that's why one of the things you see the podiatrist and you have to see the eye doctor. So the diabetes in the eye, what it does is it affects the smaller blood vessels. And then once they become a little more fragile and they're thinner, the eye needs oxygen. And in order to provide oxygen, it starts making new blood vessels, which are not normal.
Wait a minute. So you're saying eyes?
Yes, this is in your eyes.
Eyes can make their own vessels.
Yes, they will start making their own blood vessels because it starts feeling as if it's being starved for oxygen. So it starts making smaller blood vessels, but those vessels are very fragile. And then they wind up leaking and bleeding. And that's that starts the whole problem as far as like when I look in and I see the bleeding in the eye, then number one, I know the diabetes is not controlled, because that only happens if your diabetes is not controlled.
Oh, so when you say your eyes bleed, is that internally, or you can literally, the blood will literally fall down your face?
No, this is because, okay, so the eyeball is a globe. It's basically a closed globe. So it's like as if you think of a basketball, and it's really has no, it protects itself because it has no, there's no ability for just anything to get inside of it. You know, it is its own closed system. It makes its own fluid to keep itself healthy. It has its own drainage system. And it works as a machine. It's, you know, it's amazing, you know, just like the body and the brain. It's amazing. It has its own system to keep itself healthy. And inside of it, it has blood vessels. And those blood vessels are the ones that wind up being affected by the diabetes, but it's usually the smaller blood vessels. And as the eye feels a need for more oxygen because it's actually being affected, it basically creates a chemical which causes the eye to create these new blood vessels, which are not regular ones. So they tend to be weak and fragile, and they start leaking. And the blood stays within the eyeball. It doesn't go, you know, it stays within the eye itself. It doesn't come out of the eyeball. But if I look in, I can see the blood basically kind of, you know, if it's really bad, it gets to where it can be floating inside the eye. But that's like really, you know, extensive damage. But that's why people lose their vision from the diabetes, because you get these new blood vessels. The new blood vessels, because they're not normal, they start leaking. You get swelling in the eye. And a lot of times, one of the main places that's affected is that area that you're using to see. that it's called the macular area. And that's one of the main places that's actually affected. So when someone starts looking, and that's, you know, they get swelling in that area, the vessels are leaking. And if it's not addressed, you know, or sometimes, you know, what happens is if it's not addressed, or even if it is addressed, if it's too advanced, you get scarring in that area. And that's when you actually lose like the vision, because it's just like damage that can't be reversed.
And the eye is fragile. And I didn't know the eyes needed oxygen.
Oh, yes, absolutely. Because anything in your body that has like a blood supply, the blood is actually, I mean, when you think about it, like your blood, the purpose your blood going through your body is the fact that it's basically taking oxygen all over the place, you know, and it goes through your lungs, picks up oxygen, delivers it, comes back, you know. So any place in your body that has a blood supply is basically kind of like, because it needs oxygen. Once you stop the oxygen supply, that's when the tissue starts dying. And it's like it automatically tries to save itself. And it just, sometimes it just can't do it.
How about with age? What happens to the eyes with age? Because I went to the doctor maybe a month ago. And because, you know, I'm in my early 50s and my eyes were getting blurry, you know, and I didn't want to jump to conclusions, but I wanted to be sure too. Like, am I getting diabetes? Am I going blind? You know, that's the first thing that went through my mind. And when I went, she said that just comes with age.
Yes. Because you're blurred.
Go ahead.
Finish your thought.
I was just wondering, well, what happens to the eye as we age that will make us go blind or get blurry or lose our vision? Something.
Now, your blurriness, it was from far away or close up?
I think just in general, I didn't really take that many notes.
Okay, it was just in general. You noticed the difference.
All the time. I just noticed it every once in a blue moon.
Okay, so basically, the eye has a lens inside of it, which is it's like, okay, you have the iris, the color of your eye, and right behind the iris is a lens. Now that lens works like a camera lens, meaning it basically moves in order to help you focus. When we're younger, and we're, just like the rest of our body, and we're more flexible and we could do different things. And that's how the lens is. It moves, you look far away, it relaxes, you look close up, it knows it has to focus. It does that without a thought. You don't even think about it. There's nothing you have to do. As we get older, that lens starts getting a little stiff and it's not as flexible as it was. So what happens is, in order for, like, for instance, you're considered farsighted because you don't wear glasses for far away, right? So your lens basically has been able to focus easily from far away. And it doesn't have to do it so much. As you get 50, 55, 60, and you start trying to look at things close up, and it's supposed to be able to kind of contract to make sure that you're actually seeing close up. It can't do it as easily because now it's just not as flexible. It loses its flexibility. So now, because it's stiffer, when you try to look at something close, for a lot of people, all of a sudden it's like, wait, I can't bring it that close. I got to put it a little further away in order to see it. And that's just a normal change in the lens of the eye.
Yeah, well, actually, when I think about it, it is up close because I went and got me. I forgot. I went and got
a magnifier,
a magnifying glass. Yeah. So now that I think about it, it is up close.
Yeah.
So and it's strange how people can see something further away easier than they can see it, and it's something that's right in their face. I find that interesting.
Right. But the thing is, like, for instance, so you're farsighted. Like I wear glasses to see far, right? So I'm nearsighted. So for close up, I don't need glasses to see close up. Right. So I'm like, I'm opposite than you. So it all depends on your lens in the eye, as to how you're going to function. And the lens, and also, like, when you're younger, I get kids who need glasses at age 3 or 4 or 5, but it also depends upon the anatomy of their eye. Is your eye longer than normal? Then most likely you're going to need glasses to see far away. If the eye's a little shorter than normal, then you may need glasses to see far away and close up, when you're young. But it has to be a lot. It has to be, but for the most part, if you don't use glasses for far away, you're farsighted. And as you get 50, 55, and a lot of people, it happens, they'll say to me, it seems like it happens overnight. Like one day they could see their phone and they could see the menu. And then the next day it's like, wait, I can't see it.
It seems like that sometimes.
And so, but that's a natural change in the natural lens in the eye. And, when you get to the point where that lens over time gets a little cloudy, and it continues to get cloudy and glasses don't help, that's called the cataract. And that's when people have to, get surgery to remove the cataract in order for them to then see clear again.
Okay, and that it's like you was reading my mind, because that was one of my next questions. Is this, if you could, like, name some eye diseases, is cataracts considered a disease, or that's just something in your eye that has to? Could you explain what a cataract is again, and then tell me about some other eye diseases, maybe 1 or 2 more?
Okay, so a cataract, basically, everyone has a lens. You're born with a lens in your eye, which is right behind your iris. When you're younger, it's clear. Like I said, it's clear as you can see everything. As you get older, and typically it could be 45, but typically, 50, 55, 60, the lens just normally becomes a little cloudier. It's not quite as clear as when you're younger. And over time, you may find that, wow, you may see things you can see, but it's not sharp. It's like almost like seeing like things a little hazy. But you can still see and function, but you're just not seeing as well as you did. So the cataract is just, as the lens becomes a little, I guess, more dense. It becomes whiter. It can become yellow. It can become brownish as the cataract develops. people who are diabetic and have uncontrolled diabetes tend to have their cataracts progress faster, and a lot of times they're worse. So I have patients who are 85 years old and they have cataracts, but they don't need surgery because their vision is still pretty good. Versus I've had people who are 55 years old and they're diabetic and they're uncontrolled and they already needed cataract surgery. So the cataract, as you get older, and if you do need cataract surgery, it's actually one of the most common surgical procedures, done right now. It's not something that takes very long. It may take 15 minutes for them to do the surgery. It's not something you typically stay in the hospital for. And for the most part, most people after they have cataract surgery see better. Now, if you have something else inside your eye, then you may not. So that becomes a distinction. But sometimes the surgeon has to remove the cataract because it can become so bad where you can't even see through it. I can't see in your eye and you can't see out of it because it's so dense. It'll be like a yellow, brown. It'll just be that dark.
Is that laser surgery cataracts? Because how would you don't cut the eyeball open? You do have to go. You do have to go in the eye to get it, and they actually have to make a small incision in order to remove your lens is kind of in like a little bag, right? So what they do is they go in and they remove all of the material in that bag that's blocking your vision. So they actually cut the eyeball?
They
literally?
have to, right. Yeah, they have to.
Oh,
they have
wow.
to go in the eye.
Oh.
They have to go in the eye. And they make a small, very small incision, and then they put they'll put a new lens into your eye. It's folded, and it's basically gets kind of inserted, and it goes into that same bag that that's in your eye. And when they put the new lens in, when they put it in, it just unfolds, And before, years ago, the surgery was a lot of stitches and stuff. Now, most of the time, there's no stitches or anything like that because the incision that they're using is so small that it's really, like I said, it's one of the most common successful surgeries that's done.
You are,
it really is.
And common. Well, I guess it is common, but when I think about getting your eyeballs cut open, I don't even know what to think. It's not. I guess it sounds worse than it is. Maybe.
Yes. Right. Because even, for instance, people who are diabetic and they have very, very bad diabetic eye disease or diabetic retinopathy is when they have a lot of bleeding and leakage in the eyes. Sometimes they need medication inside their eyeball, and the doctor has to actually inject it into the eyeball. So the thought of someone like injecting something into your eyeball is like you said, it becomes like you don't even want to think about it. Like
sounds terrible.
Right. Exactly. But it becomes, the way to basically get this medication into the eyeball to try and save the person's vision. So.
Yeah. And what other eye diseases are there? I've heard of cataracts, but I didn't know that was actually a disease. I knew it was because I remember hearing people, I had to get my cataracts removed.
Yes.
I didn't know what to think, but now I know it's a disease, and it can just happen.
Well, it is a normal change. If you live long enough, you will get cataracts.
Okay.
It's just a normal change in the lens. Now, you may not need surgery, but it just means that your lens in your eye is not as clear as it was when you were 15 or 20 years old. It is a normal change in the lens in the eye. But you may never need surgery. You may never need surgery for it because it may not advance, to that degree.
Right. So, we talked about cataracts. So what else is there's glaucoma?
Glaucoma.
And what other eye disease?
Glaucoma.
Right.
Glaucoma is a big one, and it's actually more dangerous than cataracts. But most people, because they've heard cataracts in the name so much, they tend to be more afraid of cataracts than glaucoma.
And it should be vice versa.
Yes. And the reason is because cataracts make you see blurry. You know, someone will come and it's like, you know, I don't know, I have these glasses and like I still can't see. And then, you know, I'll check their eyes and everything else and then find that, you know, even with me changing your glasses, it's not making you see any better. So then I'll refer the person to the cataract surgeon to be evaluated for cataract surgery because I know glasses are not going to make them see better. So to that
So what's
person,
glaucoma?
Glaucoma is one of the leading causes of blindness because you don't typically feel anything. It typically does not cause pain. It typically does not make you see blurry.
Mm.
It is when the eye has, like I said, it's its own system. It makes its own fluid, which is called aqueous, and it has its own filtration system. So sometimes that fluid, either the eye can be making too much or the drainage may not be working properly, so the fluid isn't getting out of the eye properly. When that happens, the eye pressure goes up. Now,
when you say eye pressure, what exactly does that mean?
The eye has its
I'm
own
slow.
pressure because it has to stay inflated, I guess if you want to call it. It has its own pressure. It has to maintain a certain pressure or else it will shrivel up and then you don't see anything. So just like when you check your tire pressure, right? And basically when you check the tire pressure with the gauge, you're checking, you know, you push the thing up there and it's basically tests to see how much pressure comes out to push the gauge, right?
Right.
So when we check the eye pressure, it's the same concept. The different instruments we use is basically, you know, pushes the eye a little bit to see, okay, how much pressure is coming back off of your eye? How much pressure is there? Now there is a range that we're looking at, right? It has its own range of like 8 to like 20, right? Just like, you know, your car tires should only be pressurized to a certain point or else they'll explode and you don't want them under pressurized. So the eye has its own pressure to keep it healthy. Mm-hmm. Now, when it goes above a certain number, but it's very like you let's say if the range is from 8 to 20 is considered like normal, I could have a pressure of 20 and it's fine for me, but you could have 20 and it's not good for you and it can cause damage to your nerve. So with glaucoma, what happens is the pressure becomes too high for that person's eye and it starts basically damaging the nerve. Now the nerve is what we use. Without the nerve, we don't see. Because the nerve is like a cable. It's like if you think of a telephone cable with a bunch of wires, the nerve is basically 1 million nerve fibers which line the inside of your eye. And at the back of your eye, it forms a cable. And that cable is what goes back to your brain to interpret everything we see. So that bundle, that nerve, if the pressure is too high, it starts basically kind of excavating it. It kind of and it's very slow. It's not fast. It's just slow. It's a slow. And that's why glaucoma is so dangerous because while you think you'll see fine, you can see 20/20, you can see the wings on a fly, you can see close up. But in the meantime, what it's doing is that it's basically taking away your side vision. It's taking away your peripheral vision. And you don't know it until it gets to the point, by the time you realize or you even think there's a problem, it's so far advanced. So that's why, like, it's so important. Like if you're, you know, once you're 40 or 45, like you really should be getting your eyes checked at least once a year, if only to check your eye pressure. especially because if you're Black, if you're a male, and if you have diabetes or any other diseases which affect the circulation, like diabetes, hypertension, cholesterol, those things, you're at a higher risk to develop glaucoma.
Is there a cure for glaucoma? Because I was told that the hemp plant cures glaucoma. You know, that Chiba Chiba. Is that true?
No, that's not true. So there are different types of glaucoma, but the main one, there's no specific cure for it. What's done is typically the goal is to lower the pressure to the point where it's not damaging the nerve. So typically, if someone, if I see someone and I check the eye pressure, and the pressure, like I said, it doesn't have to be high, because then I also have to look at the nerve. It's a combination of things. I have to look at the nerve. How does the nerve look? So the nerve, the pressure may seem fine, but the nerve may look, like it looks a little bit excavated, right? So what I'll do is I send the person for a special picture of the nerve to tell me, okay, are the number of fibers normal or not? And it'll tell me that. The other important test is a test of the side vision, which is a visual field test. And that test basically can let us know of any, like, I can look at the nerve and think it's okay even. And that test can pick up, oh no, there's a problem with the functioning of the nerve. It's not detecting like the lights that the person is supposed to see properly. So the person gets sent for those tests to determine, okay, do they have glaucoma or not? And typically they're treated with eye drops. The eye drops, basically the purpose is to have them, the eye drops serve to lower the eye pressure. And ideally, when they're on the drops, then you use those tests that you did initially to see, okay, is this basically slowing it down? Is there no more damage? So you'll do the visual field test initially in the picture of the nerve, and then you'll repeat it maybe in 6 months. Sometimes you may watch it and wait to see, I'm not going to start you on any drops, especially if the pressure is not really elevated. Like if the pressure is 35, we're going to put you on medication to lower your pressure. If the pressure is 22, 23, and then the test results are not really, really conclusive, then we'll say, okay, you know what? We're going to hold off and we'll start you. We'll repeat the test to see, okay, are the results consistent or not?
What's in the drops? The eye drops?
Well, there's all different. Well, there are different types of drops. There's all different classes of drops. So there's some drops basically work by increasing the filtration, the spaces in the filtration areas. So some drops work that way. Okay, let's make those spaces bigger. Other drops work by decreasing the amount of fluid that the eye is making. So, okay, you know what? It's making too much fluid. This drop is going to do this. So they're all different chemical compositions, but they do different things, and they'll address it. They attack it differently. Either making it so that the fluid leaves the eye easier, or making it so that the eye is not making as much fluid.
I understand, because when I went, she put some drop in my eyes, and my eyes were so sensitive to the light. I was walking squinted. I had to get some sunglasses immediately. Yeah,
she dilated your eyes. So the dilation basically is when we put drops in the eyes, and the drops basically prevent your pupil from constricting. So when you go out, when you went outside, normally your pupil basically closes down, but it couldn't do it. So that's why when you went out, the sun is like brutal. When I go to the doctor, it's like, I'll come out and I'll put my glasses on, and it's not even that I can't see. It's just, it's so bright, and the sunglasses help so much. Because once I put the sunglasses on, I'm like, okay, wow, I can see now.
I'm good. So what is a stigma? I heard somebody the other day said that their son had a stigma. I think am I pronouncing it right?
Well, it's called astigmatism. It's Tigmatism. It's called astigmatism. So
Okay.
basically, all that is when you're a baby, when you're little, when your eye is not perfectly round, it's not like an orange. It's more so like an egg shape, right? So that's when you have astigmatism. It just means that the eye has more of an oval shape than a round shape, like a spherical shape. So when you're younger, you have it, and what's supposed to happen is as you become 4 or 5 years old, your eye is supposed to change shape to become round, like an orange, and
Mm-hmm.
you don't need glasses. But sometimes the eye is so egg shaped that it doesn't do that, and the astigmatism like stays, and it affects the vision. Now, I get a lot of kids who they can see, right? And then it's not really picked up until they enter school, because that's when all of a sudden they go to the doctor and the doctor says, read the chart, or they go to the nurse, read the chart. And all of a sudden they don't see as well as they thought they could, because everything was big, everything's fine, they can see, but they would have trouble seeing the board. So that's why a lot of times it's not picked up until the kids are of school age, because
makes sense.
they can see for the most part. They're not running into walls or anything. They can see, they can watch TV, they can look at their tablets and things like that. But when it comes to, okay, can you read that across the room, that particular letter or number? And they'll have difficulties. So we get a lot of kids. And a lot of times, like I said, the parents, you have to explain to the parents why their kid needs glasses, because as far as the parent is concerned, they see fine. So a lot of times I have to demonstrate that, okay, they can't see what you can see, because and then there are a lot of, so it becomes an educational thing for a lot of parents a lot of times, because the kid hasn't had a problem, until they went to get their eyes checked.
And that's
But
why it's important to go to the eye doctor, like you said, because you just never know.
You really don't. You really, really don't. Even like for kids, a lot of times, like when they'll go to the pediatrician, and the pediatrician checks the vision. And the vision check basically is, read that. Can you read that line? And they may be able to see 20/20. And as far as most people are concerned, okay, they're fine. But that's not true. That's not an eye examination. That's just telling me that you can see that. It doesn't tell me whether or not you have a problem with your eyes converging, what your binocular system is. It doesn't tell me whether you have a color vision problem. It doesn't tell what your nerve looks like. I mean, unfortunately, we have kids sometimes, and we can look in the eye and say, okay, there's something wrong. It's not just vision is not just 20/20. Can you read that 20/20 line? It's more than that, because your eye is an actual organ in your body, and it has blood vessels. It's got its own pressure. It's got its own focusing system, and all those things have to work together. I mean, it's part of it. It goes back to your brain. So it becomes a matter of like when especially like I said with kids, to actually just have them have an actual eye exam, and not just, with the pediatrician, basically, if you can read that line, then you're good. No, it doesn't work that way.
Now, what exactly, I've been hearing this term all my life. What is 20/20 vision? I mean, is it measured by feet and width?
It's 20 feet. So it's basically a letter that if you can see that, you can, like, for instance, you can see that letter at 20 feet, right? Mm-hmm. So, like that, okay, the big E on the chart that everyone probably knows. There's like, when you look at the vision chart, there's a big giant E at the top of it, typically. So that E is it's called the 2400 E. So let's say you don't use glasses. So I'm assuming, let's say your vision is 20/20 far away, right? Now, 2400 means now at 20 feet away, I can see that E. You could see the E at 400 feet away. So basically, when the chart was designed, it's designed based upon, okay, a person with normal vision at 20 feet away can see the very bottom of the chart, right?
Mm-hmm.
Now, let's say there's like different like gradations on the chart. So there's 2020, there's 2030, 2040, but it's based upon what a normal person can see. So you could say like, okay, that big giant E, if you were 400 feet away from it, you could still see it. Like, I couldn't see it. I'd have to go all the way up to 20 feet in order to say, yeah, that's an E. In the meantime, you're still 400 feet away. So your vision is better than mine when you're looking at distance. So 20 feet means that a normal person with normal vision can see that particular letter at 20 feet away. That letter, let's say when you're reading the bottom line on the chart, that's 2020. You're 20 feet away, you can see it. If I'm 20 feet away, I can't see it because I need glasses to see it. So I'm not 20/20 at distance.
Makes sense. How do people's eyes, what happens to the eyes when they cross? Like some people are born,
Okay, so that's called
I don't know.
That's called it's something called strabismus. So
strabismus?
Strabismus. Yes, STRABISMUS. And
okay.
So there's different types. Sometimes, like you said, sometimes a person will have the eye which drips out, and sometimes they have the eye which goes in.
Yeah, and I've seen people with the eye just keep moving too.
Okay, now that's nystagmus. That's a whole different that's like
into that next.
Huh?
I said I didn't mean to interrupt, but I'm saying after you explain the cross-eyed, then tell us about the moving eye.
Okay, so the strabismus, basically what happens is the eye has muscles on this side, right? It has muscles in between the eyes, right? And then it has other ones up and down, right? So, but when you have, let's say for instance, you have an eye which kind of drifts out. So what happens is these muscles, the one here and the one here, they're supposed to balance each other. So when they balance each other, your eye is straight. This one's not stronger, that one's not stronger. They're basically the same strength, right? Now, if one of those muscles is weaker, like for instance, if the eye goes out, that means that this muscle in here is not doing what it's supposed to do. It's too weak. And this one is basically taken over and it just pulls the eye out. So, and it's opposite. If the eye goes in, that means this one is stronger than this one. And it's basically pulling the eye in, and this one doesn't have the same amount of strength to balance it out.
Does it affect your vision or not, or just your appearance?
Well, a lot of times it does, because if, let's say for instance, especially when you're younger and the eye is doing that, you only will use one eye, right? Especially if it's like all the time. If it's sometimes, some people actually switch back and forth, They at one point they'll use one eye and the other times they'll use the other eye. Those people will have typically the same vision in each eye. Why? Because they're actually using one of the eyes at some point. If let's say the eye basically it's the same eye that goes crossing in or going out, typically that eye, the vision will not be as good because it's not getting a chance to actually see. It's basically when it turns, it's not using the proper part of the retina in order to see. It's using a part that doesn't have the capability to even see. So typically, yes, it will affect the vision. It affects like their focusing a lot of times because it becomes a constant a constant job for the eyes to try to keep themselves basically looking straight. And sometimes it's just, it can't do it. So a lot of times, sometimes kids will need surgery in order to basically try to straighten the eye.
Makes
Because
sense.
it just, and that's to try to get them so that they actually, because if you think about it, when you're looking at your depth perception to determine, let's say a baseball player, and they need to see the ball like before it gets right here. Someone who doesn't have both eyes, the ability of both eyes to look, they're not going to see it until it's like here, because they can't judge the distance. So that's the other thing that can affect their vision.
And what about when the eye just keeps moving, one eye?
Now the nystagmus, like the thing is with nystagmus, that more so it's like different things going on, because it has to do with like the neurological system, and almost like the eye just can't focus. It just doesn't have the ability to really pick up like the target. And it's not as simple as strabismus, because it has more to do with like the neurological system and not just like the structure. Like the strabismus is more the structure. Like, okay, it's this muscle, we can do this to this muscle's doing this. Nystagmus is different because it's not, you can't just fix it, because it's not just a structural problem. It's actually has to do with the sensory level of the eye and the neurological level of the eye. So you can't really fix it. What we do is we try to, sometimes you can try to give them certain types of glasses to see if to slow it down. But it's hard. It's those patients typically wind up seeing like different type of like eye specialists in order to try and get them to function. But it's hard. There's no specific like cure or surgery to fix that, like with strabismus. Strabismus, like I said, they can actually do surgery to basically straighten the eye. Sometimes glasses help to straighten the eye. If the eyes are crossed, some kids actually, if you put glasses on them, the eyes straighten out, because it's an over focusing thing which pulls them in. But with the nystagmus, when the eye is basically going back and forth, it's not something that surgery can correct, because it's a deeper level of more of like I said, it's more like a sensory sort of issue, a neurological issue, and not a problem with, okay, let's just fix this thing right here and then we'll be good. So that's why it's a little more difficult.
So there are, you said other eye specialists. There are other titles for eye doctors other than the ophthalmologist. I don't even know if I'm saying it right, but I'm gonna try.
Okay, so there are opticians, right? Opticians are the ones basically who typically make your eyeglasses. So when you have an eyeglass prescription and you take it to an eyeglass place, the optician is typically the one that makes your glasses, helps you pick out your frame, measures it and all that, right? I'm an optometrist. So an optometrist, so I did 4 years in undergrad, right? Now I did longer because I switched majors. But typically an optometrist does 4 years in undergrad and you get a bachelor's degree. Then you do another 4 years in optometry school. So it's almost like comparing to like a podiatrist goes to podiatry school, in that sense. They don't go to medical school because they're just basically focusing on the ankle down, right? So for optometrists, it's the same thing. But our 4 years of optometry school is like extensive. Like we still have to do anatomy and chemistry and organic chemistry and biology and working with cadavers and following the nervous system, and we have to do all of that. And then we'll still do, you still learn how to check the person for glasses, prescribe contact lenses. And then there's also something called vision therapy. And vision therapy deals with, it's almost like physical therapy, but for the eyes. So when for instance, a kid has a problem with their reading, where they're losing their place, things like that. You can actually use different eye exercises and different equipment to help them train their eyes to work better together. So that's vision therapy. Then there's also neuro, there are optometrists that focus on neurology and neurological problems with the eyes, people who have strokes, things like that. To help them.
Strokes got something to do with the eye. Oh, you mean they go blind after a stroke? You mean?
Well, what happens is, a lot of times, let's say when someone has a stroke, right? And let's say it's on the right side of the brain and it affects the left side of their body, right? So they'll have, they can have difficulty, with paralysis and stuff. But a lot of times it also will affect that side of their vision, only that side. Like they can see, but they'll see only like half of the vision in each eye. So what happens is, let's say they can walk straight, but they may bump into like a doorway because they don't see that part of it. Right. So where we come in is prescribing certain types of lenses. And what those lenses do is called a prism, is to shift the image to where they can actually see it. So that's, like I said, there's all different specialties within optometry.
I didn't know that at all. Do you teach a class or something? Or
do I teach a class?
Or have you? Yes.
I don't know, years ago. I've done lectures to different things, huh?
I said you should, because you really know what you're talking about. I learned so much.
I should. Better.
Now, I got one more question for you. Like the particulars of blindness, what exactly is blindness? I mean, not everybody knows what blind means, but what happens to the eye when the person goes blind? And can it be reversed?
Okay, so you can, the problem with that is that there are so many different ways to go blind.
Legally blind and all that.
Right. There's so many different ways to be blind. And most of the time, once you're blind, you're blind. Like,
it can't be reversed.
They have yet to be able to actually rebuild the optic nerve. Now, the thing is, though, what they have been doing and what they're doing is not really mainstream yet, because it's still not, probably so expensive, not too expensive for people to do it. But what they're doing is, like, for instance, someone who has a problem that affects their central part of their vision, in that macular area. Like, I'm looking at you, that's the part of my eye that I'm using inside my retina. Sometimes people can have scarring in that area. It can be from diabetes and they just have a scar there. It could be from an injury or an infection in the eye. And so what they're doing now is they're working on basically implanting almost like little telescopes inside the eye. That's actually helping.
Inside scoops.
Huh?
I didn't know that. This is some privileged information. Huh? I didn't know that.
Yeah. So they're actually have that technology where they're actually able to restore the vision for certain people, depending upon why they lost their vision and what part of the eye was affected. So that they are doing. So some people, yes, who were considered legally blind because glasses didn't help and their central vision was basically kind of so decreased. That's an option for them. But like I said, it's not like mainstream quite yet, because it's probably not. It's still like experimental, and it's probably so expensive still to be able to not only just mass produce those telescopes, but basically to find the right candidates to do it. But they actually have done that. That is something that has been done, and basically that's what they do. They actually implant a telescope in the eye, using part of that same area to help the person see again.
That'll
Because
be in the future, I'm sure.
yes, I mean, definitely. That'll definitely be so. But if someone, they say, for instance, if somebody loses their vision from glaucoma, like, and they basically it goes blind, it doesn't come back. Because
okay.
the nerve is just, it just dies. It just gets kind of killed off to the point where at the end they don't see.
I appreciate that. Now, the last part of our interview, I have something called 10 and 20.
Mm-hmm.
I'm going to ask you 10 questions and you got 20 seconds to answer them. You don't have to use all 20, but they're basically one word answers.
One word. Okay.
Basically. So you ready?
I think so.
All right. Take a deep breath. I think you got this. Would you rather be loved or respected?
Respected.
Do you prefer old school hip hop or R&B?
Old school hip hop.
I figured you was gonna say that. You see the shirt.
Yeah.
What's your favorite R&B group?
Oh man. I don't know.
Or who you like if you have to choose one? In any group you like?
Probably After Seven.
Oh shoot, they was at Harlem last week.
Oh yeah?
Yes, at the Harlem week. Favorite hip hop group?
The Cold Crush.
Oh, the Cold Crush. Would you rather be behind the scenes or in front of the camera?
Behind the scenes.
Are you a city person or country person?
Both. More city.
Would you rather drive or have a driver?
Drive.
What's your favorite decade?
Oh wow, probably the 70s.
Do you prefer summer or winter?
Summer.
Now, if you were going somewhere way across the earth, would you rather fly or take a ship? Would you rather go by water?
I'd rather fly.
Thank you. Now, I always do this 10 for 20, but it always takes 45 seconds. I'm going to have to change the name. But doctor, I'm going to start calling you doctor. I want to thank you so much for you taking the time out. Thank you for your knowledge. Thank you for your wisdom. Thank you for sharing all of your understanding as well. Now, if anybody wants to come see you because they're comfortable and they know you're knowledgeable and you have the criteria, where could they come see you at your job again, or call, or whatever the case may be?
So the number for appointments is 718-220-2020. It's Union Community Health Center. Now I actually work we have 3 different sites that I'm at. The main one I'm at is 188th Street and Valentine Avenue. I also work 1 day a week at another site for them, which is at 2021 Grand Concourse, right near Burnside Avenue. And
what's
then
the number street, like 100 and what?
2021 Grand Concourse is right between, it's Burnside and I think it's between Burnside and Bush. So it's not far from Tremont. I guess that's like 100 and I don't know, like 100.
What's the name of it?
It's called Union Community Health Center. Like they're all called Union Community Health Center. They just have different locations. And then I'm at one of their other locations, which is at 2016 Bronxdale Avenue, right near, not far from White Plains Road.
Right, I know that area.
Yes, right there.
And they'll just ask for Dr. Yearwood?
Yes, if you call, basically let them know that you'd like to make an appointment to see Dr. Yearwood for an eye exam. We accept most insurances for the most part. The only thing probably, only one that we right now aren't really accepting is if you have HIP or something called iMed as your vision provider. That's the only one. But like Health First is one of our big ones. Health First, Fidelis, I think Blue Cross Blue Shield. What else? Metro Plus.
And you see people from babies to
I
80 years
see.
old.
Yeah. So I see all ages. When it comes to like infants and 1-year-olds and 2-year-olds, we don't see a lot of them because for the most part, they're usually being screened by the pediatricians for any kind of anything out of the ordinary.
Okay.
Sometimes the parents will bring them because they just, want their kids to be checked at 1 or 2 years old. But a lot of times, like if I see a kid, that age, 1, 2, 3 years old, and I see that there's like maybe a serious like vision problem, I will actually refer them to a pediatric because there are pediatric optometrists as well,
Okay.
who specialize
Good.
in just kids. So them, like I said, I kind of consider myself like almost like a general, like a primary care optometrist because I see every age that there is, and depending upon if I find that there's a problem that I can't really handle or I think needs to be more expertise, then I will refer them to the proper specialists that they need.
Caring, also knowledgeable and caring. So thank you so much. I appreciate it. And
You're welcome, Marquez.
I'm very thankful, and I'm sure you taught me, and I'm sure whoever sees this interview is going to learn a whole lot, and hopefully it helps somebody even.
Yes, hopefully.
Yeah, so thank you very much, and you have a good night, and I'm sure I'll see you around somewhere.
Yes, you shall. Take care. Have a good one. Thank you.
Thank you.